In this pivotal randomized phase 2 trial, ONT-380 will be tested in combination with chemotherapy and trastuzumab in the salvage setting. You'll recall that patients who have had prior taxane, trastuzumab, pertuzumab, and TDM1 typically will get a salvage chemo agent in combination with trastuzumab as the preferred salvage regimen. And for this trial, the sponsors have chosen to use a combination of capecitabine plus trastuzumab as a control arm, which is very reasonable. In the experimental arm, that same capecitabine trastuzumab combination will have added ONT-380 to exploit the synergism between ONT-380 and trastuzumab in combination with capecitabine, and in that way, hopefully establish a foothold for HER2-specific, a more pure HER2 kinase inhibitor in the salvage setting in combination with trastuzumab and chemo. And if we can demonstrate proof of concept in this type of randomized phase 2 pivotal trial, we then should be ready to move it forward perhaps into earlier lines in the metastatic setting, and then hopefully one day in early stage breast cancer as well, try to once again exploit the concept of synergism between a small molecule HER2 kinase inhibitor plus trastuzumab that has been tried, as you know, in the past with lapatinib and trastuzumab. But lapatinib dosing, I think, was a challenge with those combinations because you couldn't give the full single agent dose of lapatinib. And the patient populations that were selected for some of those early stage trials had such a good prognosis that statistically it was difficult to demonstrate superiority of a combination arm. But with this agent, you're able to get a full dose of the ONT-380, strong synergism with trastuzumab, and less toxicity than lapatinib or neratinib.